Okay. So yes, hello everyone. Let me check. Am I audible so that we can start the session? So my dear aspirants, let me just check. Am I audible so that we can start the session now? So yes, hello everyone. Okay everyone, I am audible. It's okay. So I was just checking for it. Okay, so meanwhile the aspirants are joining, I would like to give you a general introduction about myself and about the platform of Unacademy. So we are targeting the Clinical Anatomy MCQ series which I have started for the NEET PG aspirants, and this is the part 4. So we are targeting the part 4 series of the Clinical Anatomy MCQs. Myself, Dr. Monalisa, has done my MD Anatomy from Armed Force Medical College, Pune, and I am here to discuss important clinical questions related to anatomy topic. Now, let's talk about the special class features. What is this? It is the free platform of Unacademy. What are the benefits of joining the free session? The benefits of joining the free session is that you can be the part of the free session. Polls are conducted and you can participate absolutely free on the free platform. Raise your hands and get your doubts clear right itself in the session. Never ever miss a session. So once the session is finished, PDF notes will be downloaded and you can be the part of this PDF notes. You can revise whichever thing you have left behind anywhere, anytime. Read from the top educators of Unacademy platform. So for joining the free session, my dear aspirants, you can use my code ANAT10 and be present for the session. Now, I would like to give you the information about my upcoming session. Before that, I want you to enroll by using the code ANAT10. So enroll by using the code ANAT10 and be present for this free mock test all India platform. So NEET PG 2022 free India all India mock test is there. So you can be the part of this session and you can be the part by enrolling by the code ANAT10. Now my dear aspirants, tomorrow is a Wednesday and Wednesday is absolutely dedicated to my dear aspirants and students, and I want to discuss the entire schedule for the Wednesday. I am starting I have got a review from my aspirants and the students. What they are telling that, ma'am, you can just revise the topic and then have the MCQs. So what I am going to do, I am starting the session like that. So these are all free special classes. What do you mean by free special classes? Just I told you, the free special classes means you can join the Unacademy free session by downloading the Unacademy app. So till now, the students, aspirants who have not downloaded the Unacademy app, go download the Unacademy app, because many features are there on the free platform of Unacademy, and then after you can be the part of my 1, 2, 3 and 4. So tomorrow I am going to take 4 sessions. Okay, so all these sessions will be of 40 minutes, 40 to 45 minutes के sessions होंगे. And in this session, firstly, I will describe the theory part. For example, the first session is general anatomy discussion followed by MCQs. So I'm not going to jump directly into the MCQs. Quickly, I will describe in the 20-25 minutes the important topics related to the general anatomy part first and second. So the entire general anatomy part, which are like cartilages, bones, the joints, the morphological aspect of the muscles, I will describe, and then I will proceed with the MCQ session of that topic only. That means if you are attentive in the class, you can solve that MCQs, and that will be very interesting and very useful. So grab that opportunity. Okay, so the first session 6 p.m. So first session 6 p.m. followed by 7 p.m. In between you will get 10 to 15 minutes of break, and the third session will be of histology session. In the first session I will describe the epithelium. I will give you all the example of types of epithelium, followed by an MCQ session related to epithelium topic. Then I will give you the general histology, important lymph node and important thyroid, important GI structure. So I will I will target the general session of histology, in which I will explain the general slides, and this will be again followed by an MCQ session. So that means tomorrow is 4 sessions. So do present for these 4 sessions and get enrolled for these sessions by using the code ANAT10. Download the app and be present for the special free platforms classes. Now, I also want to give you the information that clinical MCQ marathon were targeting the US Assembly. So the aspirants who want to appear for the US Assembly examination and they are preparing for the step 1 and step, so they can definitely, so anatomy is the preclinical subjects, and you can definitely target the US Assembly questions along with me. So I am going to take a session at 10 p.m. So this session will be again of 40 to 45 minutes, and get enrolled in this test by using the code ANAT10. 10. So ANAT 10 is the code which can be used by you and you can be present for this session. So that means tomorrow is 5 sessions, one after the other. That total 5 special free sessions. My dear aspirants, those who are missing these sessions, these opportunities, download the Unacademy app and use the code ANAT 10 and be present for my live sessions. Okay, 4 sessions, already told you the topics and timing, and this is the 5th session of 10 p.m. Now let's talk about the plus subscription. All 19 subjects are studied in a very systematic way. You can be present for this systematic study. What happens? Actually, all 19 subjects are covered up. Okay, always I know that Unacademy is a platform which is giving you an opportunity for many of the sessions to be absolutely free. But when I am talking about the plus subscription, it means that all 19 subjects, all the 19 subject topics will be targeted, and all the course will be covered up by the top educators of Unacademy platform. Compete in live tests and quizzes and grab the opportunity of solving all the MCQs. Study on the device of your choice and assess more than 25,000 MCQs. And these 25,000 MCQs can be targeted by you, and a brief explanation is provided for each and every MCQs. Coming soon, you will be provided with the printed notes of the Unacademy. So these are the benefits which can be targeted by you. Now let's talk about the iconic subscription. When I am talking about iconic subscription, you can be the part of Unacademy and Prep Ladder. So iconic subscription means your merging of the Prep Ladder and Unacademy has been done. So all these Prep Ladder benefits can be targeted along with the plus subscription benefits, that is clinical integrated essential session, video, lectures, dream team of the Prep Ladder, and also their notes. So go for this because you are getting access to the best 2 platform. Now for this also you can use my code and get an extra discount of 10%. So you can use my code for any of the subscription and grab the opportunity of extra 10% discount. Now before starting this session, let me congratulate and share the toppers images with you. Highly beneficial for them was the Unacademy subscription, and they were I am very glad to share their images, and what I want that they should target their next on the exam or the NEET PG exam in the first go. Now this is the pricing detail of the Unacademy plus subscription and iconic. You can have the comparison between the two. You can use my code and get an extra discount of 10%. Now let's talk, let's start with the session. Before that, I just want to tell you that 25,000 MCQs are there on the platform of Unacademy. Grab this opportunity. These all questions are of latest pattern, and it is also included with a detailed explanation for each and every MCQs. And code of mine, that is ANAT 10, is my code, which will provide you an extra discount of 10%. So done with this, let's start with the MCQ session. So let's move on with the first MCQ. A 35-year-old man is admitted to the hospital with indirect inguinal hernia. The man is having indirect inguinal hernia. The man is suffering from the disorder of indirect inguinal hernia. During an open hernioplasty, in contrast to laparoscopic procedure, the spermatic cord and the internal abdominal muscle are identified. Which component of the spermatic cord is derived from internal abdominal oblique muscle? The options are external spermatic fascia, cremaster muscle, tunica vaginalis, internal spermatic fascia, and Dartos muscle, and that of Dartos muscle. Okay, so these are the options and the key point which is provided here. So let me just highlight the key points for solving this MCQ right. The key points are inguinal hernia. The person is suffering from inguinal hernia. Hernioplasty has to be done. Now, the procedure involves spermatic cord and internal abdominal muscles are identified. Now, the component of spermatic cord which is derived from internal oblique muscle. So, it's a direct MCQ only. It's a clinical scenario MCQ, but the MCQ is direct. Why? Because it is directly asking that which of the component of spermatic cord is derived from internal abdominal oblique muscle. So, my dear aspirants, you can mark the correct answer. Your time starts now. I will move on with the explanation, just waiting for 13 seconds for you. Whether it is external spermatic fascia, whether the answer will be cremaster muscle, tunica vaginalis, internal spermatic fascia, or Dartos fascia, which is the correct one? According to you, which is the correct one? Okay. Okay, so yes. Now, so please mark the correct answer. Please mark the correct answer. Your time starts now, my dear aspirants. So my dear aspirants, actually it is very important that all the layers of the spermatic cord and the coverings which it is having, you should know it is derived from the abdominal muscle layer or aponeurosis. So you have to choose the right answer. So I got an answer from Bablu, I got an answer from Selva. Okay, so let me explain it. So here we have to know the layers of the abdominal wall muscles is corresponding to which layer of the spermatic cord. So this will help us to understand the correct answer. So here we have to know which of the following structures derive from internal abdominal muscle. So let me just write it and then we will come up with the correct answer. The correct answer is actually cremaster muscle. So let me write it and then it will be clear to you. So you can write here actually cremaster muscle and fascia is derived from internal oblique muscle. Okay, internal oblique muscle. So this was asked in the MCQ. So we have chosen this as the correct answer. Now, external spermatic fascia is derived from which layer or aponeurosis of abdomen? Anyone? Aponeurosis of external oblique muscle. It is derived from aponeurosis of external oblique muscle. Now, tunica vaginalis, it was also given as one of the options. Tunica vaginalis. Whenever we are talking about tunica vaginalis is derived from the processus vaginalis. It is derived from processus vaginalis. Now the next point is this processus vaginalis is actually formed from parietal peritoneum. It is formed from parietal peritoneum. We know that peritoneum is having two layers. The inner one is the visceral and the other outer one is the parietal one. And it covers the lateral anterior aspect of the epididymis and the testis. So it is covering the epididymis and the testis and it is derived from the embryological structure processus vaginalis. Now internal spermatic fascia. Internal spermatic fascia is derived from which layer of the abdomen? Any idea? It is derived from transversalis fascia. Okay, so done with this. These are, so clearly these are the important for your MCQs, all these points. So please do revise. Okay, cremaster muscle and fascia derived from the internal oblique muscle. External spermatic fascia derived from aponeurosis of external oblique muscle. Tunica vaginalis is the extension of processus vaginalis and internal spermatic fascia is derived from fascia transversalis or transversalis fascia. So done. Okay, one more option was given. So clearly it is now known that the correct answer will be cremaster muscle because this is the muscle which is derived from internal oblique muscle, so of the abdomen. So this is the correct answer. The one of the option that is Dartos muscle, which I have not told you. So let's talk about Dartos muscle also. So yes, I will come to that point. Before that, just have a look on this diagram. This is a diagram which is exactly, if I enlarge this diagram, it will be more easy for you to understand. So see here. The abdominal layer, when proceeding towards the scrotum and the spermatic cord, it is forming various layers. So see here now external. So this is external abdominal oblique muscle. External abdominal oblique muscle. You can see it is forming external spermatic fascia. Clearly in this diagram, it is shown with the green color, and this extension which you are seeing here is derived from external aponeurosis muscle forming external spermatic fascia. So is it clear? So clearly I am also just showing it with the green color. So this is the continuation. Now let's move on to the internal one. So when I am talking about the internal, when we are talking about the internal aponeurosis, so this is the internal abdominal muscle and the aponeurosis, and if you will see its extension, it is extending here to form the cremaster muscle and fascia. It is forming which structure? It is forming cremaster muscle and fascia. Now, transverse abdominis muscle. When I am talking about transverse abdominis muscle, so this is transverse abdominis muscle, and you can see the transverse abdominis muscle is ending here itself. It is not continuing. So transverse abdominis muscle is not forming any layer. Transverse abdominis muscle, please note down, it is not forming any layer of the spermatic cord. Okay, now the innermost layer is that of, let me use red color for it. So this is the transversalis fascia, and you can see here the transversalis fascia continuation is in the spermatic cord forming internal spermatic fascia. It is forming internal spermatic fascia. So is it clear? Is it clear? Now, processus vaginalis. Okay, here you can see the processus vaginalis. Here you can also appreciate here. This is the obliterated tract of the processus vaginalis, and what I told you, processus vaginalis is continuing to form tunica vaginalis, which is also shown in this diagram. So all these extensions are clear in this diagram. This single diagram is letting you understand all the layers. Is it okay, everyone? So in this single diagram, we are knowing all the layers of abdomen except the transverse abdominis muscle is not forming any of the spermatic cord layer, but all other layers, external abdominal, internal abdominal oblique muscle and fascia transversalis is forming the layers, that is external spermatic fascia, cremaster muscle and internal spermatic fascia. We have done with this. I have already given you the notes, and this diagram is also showing the similar thing. So before that, I also want to before moving on to the Dartos muscle, I just want you to show this image. And why I want to show this image, because this is a transverse section of spermatic cord, and this is showing the structures lying inside the spermatic cord. So this is the transverse section of spermatic cord, which is showing you the structure inside the spermatic cord. So yes, let's slightly move up and see the structures which is the component. What are the complete spermatic cord is containing which all structure? It is containing ductus deferens. So it is containing, as you can see, vas deferens and lymphatics, and it is containing cremaster vessels. It is containing genital branch of genitofemoral nerve, testicular arteries, testicular veins, pampaniform plexus, lymphatics, and it is also having the vessels like the vessels arterial supply of ductus deferens. So that are all the contents. So all the contents of the, so you can see here testicular veins has been shown, the testicular arteries has been shown, sympathetic plexus which is covering it, the vas deferens and the arterial supply of vas deferens inside, processus vaginalis. All these structures are the contents of spermatic cord. So actually for your examination point of view, it is important that you should know the contents of spermatic cord. So quickly write down the contents of spermatic cord, my dear aspirants. Contents of spermatic cord. So contents of spermatic cord are following. It contains, this is also very important for your examination, that you should know all the contents. So actually it is consist of, it is having many important structures residing. So we can see ductus deferens. What is ductus deferens? Vas deferens. We have got here arteries. Okay, arteries are also there. We have got cremaster, we have got testicular arteries. We have got cremaster artery. We have got artery to vas deferens. Other than that, we have got testicular vein, that is pampaniform plexus of veins, pampaniform plexus of vein, that is of testicular vein. We have got genital branch of genitofemoral nerve, genital branch of genitofemoral nerve. And sympathetic plexus, we have got sympathetic testicular plexus and lymph vessels. And what? Lymph vessels. So all these are important structures which is lying inside the spermatic cord. Now, when you will do the dissection also, you can appreciate these structures. Other than that, what I want you to know more, so can anybody tell me testicular artery is a branch of which artery, cremaster artery is a branch of which artery, and artery to ductus deferens is a branch of which artery? Okay. So here testicular artery is directly the branch of abdominal aorta. Okay. Cremaster artery is a branch of inferior epigastric artery. Artery to vas deferens is a branch of inferior vesical artery, So please write down these three arteries has three different sources. So the three arteries which is residing inside the transverse section of spinal cord is having three sources. So done with this. Now, what was the other option which was given? The other option was Dartos muscle. So let's talk about Dartos muscle. Now, Dartos muscle is actually shown in this diagram, and here we can see this is the Dartos muscle. Actually, Dartos muscle is formed by, this is a muscle which is located in the superficial fascia. So, this is an example of panniculus carnosus muscle. All the muscles which is located in superficial fascia is called as panniculus carnosus muscle. So, Dartos muscle is formed by blending of adipose tissue and membranous. So, actually it is formed by blending of fatty layer or adipose layer or fatty layer, that is campus layer, along with the membranous layer. And what is the membranous layer called as? Membranous layer is called as scarpa layer of the abdomen, lower down when it is going down, and it is mixed with this all superficial fascia is mixed with smooth muscles, and together they are forming the muscle. What muscle? That is Dartos muscle, and Dartos muscle is an example of muscle located in superficial fascia, so it becomes an example of panniculus carnosus. Done with this? So, let's move on to the second MCQ. All the best, my dear aspirants. Let's move on to the second MCQ. So, I think detailed explanation is given for the first. All those who have forgotten, they can revise it. Let's move on to the second. A 56-year-old man is diagnosed with mid-gut volvulus and intestinal ischemia. Laparotomy is performed to release the obstruction of intestine. Which of the following structure is used as a landmark to determine the position of duodenojejunal junction? Okay, so got it. So here the options are superior mesenteric artery, inferior mesenteric artery, vasa recta, suspensory ligament of duodenum, that is also called as ligament of Tres, or Phrenicocolic ligament. Okay, so let me mark the key points. This is a case of intestinal ischemia. Okay, and midgut volvulus, and we have to find out the obstruction of intestine. So, which of these will be used as a landmark to determine the position of DG junction, duodenum and jejunum junction? So, again this is a clinical question, but exactly the anatomical position or the important structure attached to duodenojejunal junction has been asked. So, Ajay Selva has given his answer. Okay, Ajay Selva has given his answer. What about others? So, Ajay Selva, you have given absolutely correct answer. Suspensory ligament of duodenum or ligament of Tres is the right answer. Why suspensory ligament of duodenum or ligament of Tres is the right answer? Because this is the ligament which originates from right crux of the diaphragm, and it is attached to the fourth part of the duodenum. To be more specific, it is attached to the fourth part of duodenum at the junction of duodenum and jejunum. The ligament is commonly used by a surgeon for locating the duodenum-jejunum junction. So, this is the right answer. Okay, so clearly suspensory ligament of duodenum or ligament of Tres is the right answer. So, suspensory ligament of duodenum. The other name is ligament of Tres. Okay, so what is the origin of this structure? The origin of this structure is from the right crux of the diaphragm, and it is lower down, and lower down it is attached to fourth part of duodenum. Lower down it is attached to fourth part of the duodenum at the level of DJ junction, at the level of DJ junction, duodenum jejunum junction. Okay, the ligament is a very important guidelines for the surgeons to locate the duodenum and jejunum junction. Okay, so I would like to show you a diagram for it, all of you. So see this. This is a very clear diagram which is showing you the ligament of Tres in this diagram. So, okay, so I just want to show you this diagram. So, here you can appreciate, let me just use this green color. This structure which I am highlighting in the green color, this is the ligament of Tres, and you can see here ligament of Tres is attached to the right crux of the diaphragm. Okay, so here you can see this is the ligament of Tres which is attached to the lower down, it is attached at the junction of duodenum, DJ junction. Lower down it is attached to the junction of DJ junction, and upper down it is attached to the right crux of the diaphragm, which is shown here, in the diagram also. Clear? Now, Also, you can have a clear view if you want to have a, this is again a diagram from the Knitter's book, and you can see here this is the ligament of Tris attached to duodenum and jejunum flexure junction, and here it is attached to the right crux of the diaphragm. Right crux of the diaphragm. Got it, everyone? So, is it clear? So, this is right crux of the diaphragm. Now, okay, so done with this. Now, I would like to talk about Phrenicocolic ligament, and before that I would move on with the incorrect option. So, other options which is given. So, my dear aspirants, let's move on to the other option. So, we have already done about the right answer and we have talked about the ligament of Tris, but I want to just brief the other options which is given, the incorrect options. So, yes. Here the other options like superior mesenteric artery, inferior mesenteric artery and vasa recta. Definitely it can't be the right answer, and the reason is that superior, inferior mesenteric artery, vasa recta are quite variable in location. They are highly variable. Okay, they are not constant in position, they are highly variable in position, so they can't form they can't be used as a landmark for locating DJ junction. Got it? Now, other than that, we have got Phrenicocolic ligament. So, I would like to, this is also not the correct answer, which is not forming a landmark for the attachment of DJ junction, but I would like to show you a diagram and explain this. So, let's move on to the Phrenicocolic ligament. So, the Phrenicocolic ligament is also called as Hensing's ligament. What is it called as? It is also called as Hensing's ligament. Now, it is a fold of peritoneum which is also called as Phrenicocolic ligament. Actually, it is a continuation which is attachment is on the left colic flexor to that of thoracic diaphragm. So, exact attachment is corresponding to the level. What is the level of its attachment? It is corresponding to the attachment at the 10th and the 11th rib. It is a fold of peritoneum which is continued from the left colic flexor to that of thoracic diaphragm. So, it is serving, actually when we are talking of Phrenicocolic ligament, it passes below the spleen and it is actually serving a support for the spleen so that it is not lagging down, and this is also called as sustentaculum linus. So, the other name of Phrenicocolic ligament is sustentaculum linus. Okay, but this is not forming a landmark for the location of DJ junction. So, see here in this diagram what you can see clearly the Phrenicocolic ligament. Here, this is the Phrenicocolic ligament. Okay, so this is exactly the Phrenicocolic ligament which has been shown, and it is attached on the left colic flexor. It is attached onto the left colic flexor, and above it is attached to the diaphragm. It is acting as a sustentaculum tali. Now, other than that, please just see, this is a lad band. Okay, you are seeing the extension of lad band is from the cecum. So, extension of lad band is from the cecum, and it is extending from the cecum, and it is getting attached to the abdominal wall. So, actually lad band is connecting cecum to the abdomen. It is connecting cecum to that of abdominal wall and can obstruct the duodenum. What it can do? It can obstruct the duodenum in cases of it can obstruct the duodenum in cases of malrotation, malrotation of intestine. This can form a obstruction, and these bands has to be surgically resected, and it can also be not used as an important junction or a landmark for DJ junction. Okay, so we have done with this. Now let's move on to the third MCQ. Question number 3. A 5-year-old boy has been playing with a small toy car. 5-year-old boy is playing with a small toy car, and soon after he put the wheel of that small toy car in his mouth and began choking and coughing. Okay, the boy is having choking and coughing, that it is lodged in the one of the following structure. So, where in the tracheobronchial tree it is the most common site that the foreign object is lodged, whether the site is right principal bronchus, whether the site is left principal bronchus, the carina of the trachea, the beginning of the trachea, or the left tertiary bronchus. According to you, which is the best answer? So, yes, your time starts now. Please mark the correct answer. Question number 3. Ajay Shelva has given C as his correct answer. What about others? Okay, so the history is provided that the small boy is putting the wheels of the toy car inside. So actually, if I have to mark the correct answer, I will go up with right principal bronchus. Right principal bronchus. So I will go up with right principal bronchus as the correct answer. Here, right principal bronchus is the correct answer. So I will help you to understand why. So actually, when you will see the course of right principal bronchus, it is if you compare it with the left principal bronchus, it is more wider, shorter and more vertical. So it is more vertical in comparison to the left principal bronchus. So there, this is the reason that any foreign structures will get lodged in the right principal bronchus in comparison to the left principal bronchus. So this is not, so we have to choose one. We will go with right principal bronchus as the correct answer. So the reason I have told you, and waiting for other, like other option is like carina of the trachea. So I will come up with all the options. So firstly, I will show you the diagram also. Right principal bronchus. What is the reason that right principal bronchus is the right answer, or the foreign structure? So actually the foreign body will be lodged in the right principal bronchus. The reason is that it is wider, it is shorter and it is more vertical. More vertical in comparison to left principal bronchus. In comparison to left principal bronchus. Left bronchus or left. Okay. Okay, this is the reason. Now, so let me just show you this. So see this diagram, what you can appreciate, this is the trachea, and exactly one of the option, a few students has also given carina as the right answer, but my dear aspirant, the carina is not the right answer, because if you talk about carina, carina is a ridge separating, it is exactly, if you talk about this is like a ridge which is separating the right and the left principal bronchus, and the most common site, if we have to choose, we will go with right principal bronchus. Okay, so it is fork like divergence of the right and the left bronchus. So yes, so see here, if you will see, and if we are going to draw a vertical line passing through this, you can see the angulation, it is more vertical is the right principal bronchus in case so it is more in line with the, it is more, angulation is less, and also angulation is more in the left principal bronchus in comparison to right. So I will show various diagrams, it will be clear to you. See one more diagram. So here you can clearly see, this is the this is the line, which is the vertical line, which is showing that the right side, the angulation is less in comparison to the left side. So you can see the divergence or of the left principal bronchus is more. So this is the left hand side and this is the right hand side, and you can clearly see the left side principal bronchus. You can see here it is narrow also, it is longer also, it is short. Right one is short, it is wider also, and it is more vertical. So there is more chance. That the foreign structure will be lodged in the right principal bronchus. Is it clear, everyone? Ajay, Parvej? Now, if you are not satisfied, now see this, then you see this diagram. So if you are not satisfied till now also, so see this diagram. This is the chest x-ray POV, and here what you can see, the angulation. So right hand side and left hand side principal bronchus angulation has been shown, and here you can clearly see in the right hand side the angulation is approximately 20 to 30 degree, but in left hand side the angulation is more, it is approximately 45 to 50 degree. So right one is shorter also, right one is wider also, right one is less angulated also. So the chance of foreign structure to be lodged will be more in the right bronchus or right principal bronchus. Okay, got it, everyone? So now, so we have got the right answer. Now I would like to rule out the left. So no doubt about the left. Why left is wrong? Left is not the area where the foreign body will be lodged. The reason is that it is longer, more angulated, okay, and narrow also. Now, carina of the trachea is not the right answer. Carina is actually having a ridge supporting. It's actually a ridge separating. You can say it is a ridge which is separating the right and the left principal bronchus, right and the left principal bronchus, and more chance, the most common chance will be that of the right bronchus. Beginning of trachea is also not the right, because trachea is itself supported. Trachea is itself supported by incomplete tracheal rings, incomplete cartilaginous ring, so there is less chance that any foreign structures will be locked in the trachea. Tertiary bronchus, actually tertiary bronchus is far more distance from the principal bronchus, and there is very less chance, very less chance, or in very severe cases only foreign structures can be lodged at this location. So the most common location will be right principal bronchus. Okay, my dear aspirants, let's move on to the next, that is question number 4. Is it clear? Can we move on to the next MCQ? Ajay, Selva, Parvez, everyone? So yes, let's move on to the question number 4. A 34-year-old man, unconscious patient, is admitted to the hospital. His blood pressure is 85 to 45, okay, and central venous line has to be placed. During subsequent radiologic examination, a chylothorax is detected. Chylothorax is detected. So, which of the following structure was most likely accidentally damaged during the placement of the central line? Whether the structure being damaged is left external jugular vein, site of origin of left brachiocephalic vein, right subclavian vein, proximal part of right brachiocephalic vein, or right external vein. Question number 4, please mark the correct answer. So the key point is that chylothorax is detected. So that is giving the hint that which structure has to be approached and which structure is lying very close to it, that will give you the correct answer. So that means chylothorax is detected means thoracic duct is involved. So in this case, thoracic duct is involved. I have given the list. So chylothorax is usually caused by injury to, it is caused by injury to thoracic duct. Okay. So that means, and we know that thoracic duct is actually draining at the junction of left internal jugular vein and left subclavian vein. If you talk about the thoracic vein drainage or termination, thoracic vein is terminating exactly at the junction of left subclavian and that of left internal jugular vein. So we have to choose the best structure lying close to it. So the best structure which is lying close to it is the left brachiocephalic vein. Left brachiocephalic vein only has got its divergence, and we can see very close to left brachiocephalic vein, the two important tributaries of it is that of the left subclavian and left internal jugular vein. So we will go with B as the correct answer. So this is giving us the hint that B is the correct answer. So for this MCQ also, I want you to show the diagram so that you can understand this. So let me show you the diagram. So if you want, I will write the whole answer for you. This is the chylothorax is usually associated with injury to thoracic duct. So this is a case of injury to thoracic duct. Okay, thoracic duct enters the venous system. So when we are talking about thoracic duct entry in the venous system, entry in the venous system is at the junction of two important veins, at the junction of left subclavian vein and left internal jugular vein in IGV, internal jugular vein. So exactly at the junction of left subclavian vein and the left internal jugular vein. Okay. So actually this is exactly the junction, and there it can be when we are talking about so if we and this is the location where the left subclavian vein and left internal jugular vein leads to the formation of left brachiocephalic vein. Left brachiocephalic vein. So we will go with left brachiocephalic vein as the correct answer. Okay, penetrating injury at the level of left brachiocephalic vein can disrupt the termination of thoracic duct, So we will choose B as the correct answer. So for this, you can see firstly this diagram. Here if I enlarge this diagram, here you can see the thoracic duct start ascending up from the cisterna cali, and ultimate termination, if you want to see the termination. So see here, this beaded structure which you are seeing is the thoracic duct, and in this diagram you can clearly see the termination is at the junction of left jugular vein and that of left subclavian vein, left jugular trunk and that of left subclavian vein. Okay, so exactly at the junction of these two veins, and you can see this is forming here, this is the left brachiocephalic vein, so this will be the correct answer. So one more diagram I want to show, so let me show you this enlarge, let me enlarge this diagram. So yes, all of you just see this diagram. What you can appreciate here, the green color structure is the thoracic duct, and this thoracic duct is draining into or terminating at the junction of left subclavian vein and that of left and that of left jugular vein. So see here, exactly this is the, okay, this is the left subclavian vein, and this will be the left, this will be the left internal jugular vein, and this is draining into left innominate vein. What is the other name of left innominate vein? Left innominate vein is also called as left brachiocephalic vein. So injury is onto the which structure? Left innominate vein. Is it clear? Everyone, Prarvez, Ajay, everyone, Pradeep, is it clear? Yeah. So we will choose left brachiocephalic vein as the correct answer. Let's move on to the next, that is question number 5. A 35-year-old woman patient has got a hard tumor of about 1 centimeter in the diameter, slightly above and lateral to her right areola. A specific dye was injected into the tissue around the tumor, which was taken up by the lymph vessels draining into the area. An incision was made to expose the lymphatic vessels, which were then visible with the naked eye. The vessels were traced to surgically expose the lymph node receiving the lymph from the tumor. Which node will most likely the first one to receive the lymph from the tumor? Whether it is anterior or axillary or anterior axillary, which is also called as pectoral lymph node, whether it is lateral axillary, whether it is a central axillary, or whether it is apical. According to you, which is the correct answer? Question number 5, please mark the correct answer. Okay, so according to you, so the key point I will tell you, the key point to mark the correct answer is that, okay, so the lymph which is receiving the lymph node from the tumor, so which node is first? Okay, which node is first? So the tumor is approximately 1 centimeter above to her right areola. So mammary gland is involved, and you have to know the first lymph node to be involved. So I got an answer from Ajay Selva, and Ajay Selva is giving perfectly right answer. The correct answer will be anterior axillary or pectoral lymph node. The reason is that lateral quadrant of breast. Okay, see here, lateral to her right areola. What does that mean? Lateral quadrant of breast. So when we are talking about lateral quadrant of breast or mammary gland, basically the lymphatics are draining into anterior axillary lymph node. So the lymphatics are draining into anterior axillary lymph node, which is also called as the pectoral group of axillary lymph node. So actually 75% of the lymphatics of the breast are draining here. In the more commonly involved is the anterior group or the pectoral group. If we talk about the medial quadrant, of the breast, then their lymphatics are draining into parasternal node with the some which is crossing the opposite side also. Small amount will drain into the inferior part of the brain. So small amount will drain into from the inferior part of the breast will drain into the lymph node of anterior abdominal wall. When we are talking about apical and central, they are generally getting lymphatics from these group anterior. So lateral is basically draining more of the lymphatics from the upper limb. So these all are wrong. We have to choose the best answer. So we will go with anterior axillary or pectoral as the correct answer. Okay. So let me show this diagram for you. So in this diagram you can see, when we are talking about the quadrant, that is lateral quadrant, basically all the lymphatics are being drained into the axillary lymph node here, and basically it is drained into, if you will see here, basically it drains into anterior or pectoral group of lymph node. Okay. Mammary group of lymph node. The medial one, if we talk about the medial one, the medial quadrant of the breast, the lymphatics are draining into Okay. When we are talking about the medial quadrant of the breast, its lymphatics are draining into parasternal lymph node. So if you want to note down this point, please. Okay, let's write it for you. So all the best. So please write down lateral quadrant. When I am talking about lateral quadrant of mammary gland or breast, lateral quadrant of mammary gland, its lymphatic drains into, the lymphatics of lateral quadrant drains into anterior axillary lymph node, and it is also called as pectoral group of lymph node, So 75% of the lymphatic of the breast drains here. Now, when we are talking about the medial quadrant of the breast, that is mammary gland, the medial quadrant of breast or mammary gland, its lymphatic drains into parasternal lymph node. Some of this will also drain into opposite side. Some of this lymphatics will also drain into opposite side parasternal lymph node. Okay, now the third, the small amount of inferior part of the breast. So when we are talking about the inferior part of the breast, small amount of the inferior part of the breast or mammary gland, its lymphatics also drains into the lymph node of anterior abdominal wall. So we have to choose one. We will definitely go with the correct answer, the pectoral or anterior. Let's move on to question number 6. All the best, my dear aspirants. A 55-year-old man is admitted to the emergency department because of chills followed by a painful dry cough and fever for the past 3 days. The patient complains of painful breathing and upon auscultation, a pleural rub is heard. When the patient breathes, okay, radiograph shows the sign of pleurisy. The physician decides to administer a local anesthetic lidocaine. To which of the following nerves is the local anesthetic infiltrated? Whether it is intercostal nerves, whether it is phrenic, vagus, cardiopulmonary or recurrent laryngeal nerve. So what is the correct answer, my dear aspirants? Question number 6. Please mark the correct answer. Your time starts now. Which is the correct answer? 50. So here key points, let me highlight. So key point is a pleural rub is heard. So you can understand the case and then you have to know local anesthetic is anesthetizing which of the following nerve. Okay, Ajay Selva. So is this the answer for question number 6? Please write down that also because I will not get confused with that. So if I have to tell the right answer, I will go with intercostal nerve as the right answer. Intercostal nerve is the right answer. Why? Because this is a case of pleurisy. It is a case of signs is showing the pleural rub is here. So pleura is affected and pleurisy is the case, and we know that the pleura is getting innervation from that of intercostal nerve. So we will go with intercostal nerve as the correct answer. So see here, pleuritic pain is due to inflammation. When we are talking about pleuritic pain, it is due to inflammation of the parietal pleura, and parietal pleura is having the innervations by intercostal nerve. So okay. So no, yes, I can know that you can get confused with the phrenic nerve also, because phrenic nerve is also is lying anterior to the hilum and it is running. But if we have to choose one, we will go with intercostal nerve because we have to anesthetize that area and we have to relieve the patient of that pain. So we have to choose one. We will definitely go with intercostal nerve as the correct answer. So here you can see the pleural sac has been shown, and you can see here clearly that these intercostal nerves has been shown, and intercostal nerves are giving innervation to the pleura. So to relieve the pleuritic pain, we will infiltrate the local anesthetics in the intercostal nerves. Now, the phrenic nerve also supplies the central and diaphragmatic. If we are talking, so I can understand few of the students can get confused with the case of phrenic nerve. Why? Because we know that phrenic nerve is also supplying the pleura. But if we want to know exactly which part of the pleura is getting innervation from the phrenic nerve, that answer will be it is supplying the central and the diaphragmatic part of the pleura, which is not typically affected in the case of nerve block. Got it? So this is the reason it is more on the diaphragmatic part and the central part of the pleura. Now, let's talk about the other option. Vagus nerve is the wrong answer. Why vagus nerve is the wrong answer? Because vagus nerve is supplying visceral efferent and afferent. Vagus nerve is supplies visceral efferent and afferent to the lungs and the visceral pleura and not to the parietal pleura. Okay, we know that both the vagus nerve, which is ascending towards the hilum, posterior part of the hilum of the lung, it is not giving any innervation to parietal pleura. Cardiopulmonary nerves are not carrying any kind of somatic fibers. Recurrent laryngeal nerve is not lying in relation with the pleura or innervation. We know that on right hand side recurrent laryngeal nerve, on right side recurrent laryngeal nerve is winding around subclavian artery, and on left hand side recurrent laryngeal nerve is winding around arch of aorta. Okay, so let's move on to question number 7th. A 36-year-old woman is admitted to the hospital for imminent birth of her baby. The decision is made to perform emergency cesarean section. A phalansteal incision is to be given to reach the uterus. That is transverse incision, which is lying over the rectus muscle and sheath. Approximately the location of the incision is approximately 2 centimeters above the pubic bone. So that is an important key feature which is mentioned here. So it follows the natural fold of the skin and curves superior to the pubis. So you just tell me what would be the nerve to get risk in the injury. So if the incision phalansteal incision, which is given for the C-section, is just lying 2 centimeters above the pubis. So which is the nerve which can get injured in this case? A, B, C, D or E? According to you, which is the best correct answer? So you have to know about the incision also. Location is also mentioned. It is lying. Location is also mentioned 2 centimeters above the mons pubis. So which of the following nerve is most likely to be injured? T10, T11, iliohypogastric, ilioinguinal or lateral femoral cutaneous nerve? Which is the correct answer, dear? Question number 7th. The correct answer is iliohypogastric. So phalansteal incision approximately 2 centimeters above the pubic bone will involve iliohypogastric nerve. The reason is that actually when we are talking about this iliohypogastric nerve, so let me explain the iliohypogastric nerve. Iliohypogastric nerve, basically iliohypogastric nerve is majorly formed by L1 having the root value, and this is a responsible nerve for giving the innervation. The area of its innervation is lying just above the pubis, mons pubis. This is arising from L1, sometimes takes few ticks from T12 also, and transversely passing through the lowest portion of and it is passing towards the lowest portion of rectus sheath. And exactly the incision is also located at this location, so this will be involved in this case. So iliohypogastric nerve will be injured in this case. So you can just appreciate that just above the mons pubis, there is the location of this incision which is transversely running. Okay, this is the transversely running, as you can see here. This is exactly the incision which has been shown, and just lying above the mons pubis. Now, see this diagram which will help you to understand. So, if you will see so see this diagram, let me just enlarge this. So, you can clearly appreciate that, iliohypogastric nerve, which I have marked as the correct answer. What you can appreciate, this iliohypogastric nerve is giving innervation, iliohypogastric nerve on this location, that is lying above the mons pubis. So, this is the best answer. What about the other options? So, other options, let me move on with the other options. So, the other option was T11 and T12. So, see here, T11 and T12 are lying T11 and T12 is lying above the incision line. It is lying above the incision line. So, it can't be the correct answer. Okay. Now, so both are wrong. Ilioinguinal nerve courses and the inguinal canal, and it is lying on the lateral side of the spermatic cord round ligament, and it is lying inferior to incision. So, the location of ilioinguinal nerve is also inferior. See here, it is traversing, it will traverse through the inguinal canal, and then its ilioinguinal nerve will pass lower down. Now, lateral femoral cutaneous nerve. What about lateral femoral cutaneous nerve, which was given as one of the option? It traverses lateral to psoas major muscle. As you can see this in this diagram, this is the lateral femoral cutaneous nerve, and this is traveling lateral to psoas major muscle, and it will appear from abdomen to the towards the anterior superior iliac spine. And the major role of lateral femoral cutaneous nerve is to give innervation to lateral aspect of thigh. When it is compressed, what will happen? It can cause meralgia paresthetica. So, clearly we have got iliohypogastric as the right answer in this case. So, yes, we have approached for the correct answer here. So, clearly we have got iliohypogastric as the correct answer. Now, T10 is not the right answer. It is giving innervation to area around umbilicus. Wrong. T11 is wrong. Ilioinguinal is wrong. Lateral femoral cutaneous nerve is wrong. So, the correct answer is iliohypogastric nerve. Got it, everyone? Now, before ending the session, I would like to give you some information. So, see here. So, it is very important for you to know the upcoming sessions. Tomorrow is Wednesday. My dear aspirants, please note down that tomorrow is Wednesday. So, tomorrow is Wednesday, and on Wednesday, there is a session of special classes coming for you. So, many of the students are telling me, ma'am, quickly cover up important topics in brief, don't go much detail, and then the MCQ session. So, all the general anatomy, part 1 and part 2, all important topics I will brush कर दूंगी, मैं revise करा दूंगी. I will revise it for you, and we will have 20 minutes followed by MCQ session. So 40 minutes session है, 20 minutes theory part, 20 minutes MCQ. Next is important epithelium. I will tell the crux point to identify and examples, and then followed by MCQ. Then general histology, important points, followed by MCQ. So all these sessions will be of 40 minutes each, 40 to 45 minutes each, 40 to 45 minutes maximum. And the timing of tomorrow, this is going to happen tomorrow, that is 9th Feb Wednesday. Please note down, tomorrow 9th Feb Wednesday. Okay, these sessions 6 p.m. followed by 7 p.m, 8 p.m. and 9 p.m. session. So, do present for this session. All of you can download the Unacademy app, and after downloading the Unacademy app, use the code ANAT10 to get enrolled for this free sessions. Okay. And I also want to tell you about 10 p.m. tomorrow session. So, tomorrow actually 5 free sessions I am taking. 10 p.m. session, those who are interested can join. They can join by using the code ANAT10, and this is a clinical MCQ marathon of target is US Assembly examination. So, we know that in US Assembly examination, clinical MCQs are the target. So, I am taking 10 p.m. session, 6 p.m, 6:30, 7, 9 and 10. So, my timing is 10 p.m. session. The session will be of just 40 to 45 minutes, and do join me live for the MCQ session targeting for the US Assembly examination. Are you ready for the mock test, which is going to happen on 19th Feb 9 a.m. Enroll in this test by using the code ANAT10. So, this is a free platform test for your practice test for All India mock test. Go for it, definitely. And before ending the session, this is the pricing detail of NEET PG and Iconic. I also want to tell that the session will be followed by open house. So after completing all the YouTube session, there will be an open house. All of you can participate in open house. It will be useful for you. I will wind up the important points, and the session of open house are just of 15 to 20 minutes. So I will wind up all important topics, and we can go with open house session. So this is the pricing detail of NEET PG, Iconic and Plus, which can be compared by you. Use the code ANAT10 to get extra 10% discount and take the subscription. This will be highly beneficial. So all of you can join me for the open house who are interested. So all the best, keep studying, and do present tomorrow for the special classes, for the special free platform classes. All the best. Thank you, and do like and subscribe the channel. Let's crack NEET PG. Also my 8 PM session will be brachial plexus part 2 on the Unacademy Future Doctors live. Those who are interested can join. Now going for the open session. All the best, keep studying. Thank you so much. Thanks, my dear aspirants. Thanks. Thanks. Open house is going to happen. Okay, connect. So connect on open house. Open house is on your Unacademy Unacademy app. My dear aspirants, the session link will be on the Unacademy app. So when you open your Unacademy app on your mobile, you can see the session link, and via that you can connect to me. All the best. Thank you. Thanks, dear.